So welcome everyone to Oscar Care Group's webinar on Dementia and Speech Pathology, More Than Dysphagia. My name is Michaela and I'm a speech pathologist at Oscar Care Group. I'll be taking you through today's webinar. Speech Pathology Australia have recognised a really large service gap in speech pathology services in dementia, especially with communication-based interventions. The most common referrals to speech pathology when someone is living with dementia are difficulties in swallowing or dysphagia. While dysphagia is incredibly prevalent in individuals with dementia, every single person with dementia will also experience communication difficulties. Speech pathologists can play a vital role in assisting someone with dementia with their communication, and so today I'll be delving into how exactly we can assist. Firstly, we'll take a look at the types of dementia. So dementia is an umbrella term for various neurological conditions that can cause a loss of neurons and connections between those neurons in the brain. While Alzheimer's disease is the most common form of dementia, there are also many different types of dementia, including vascular dementia, Lewy body dementia, and frontotemporal dementia. There are also rarer types of dementia that are caused by other diseases and conditions. These different types of dementia can generally show different behavioural presentations, and the same applies to someone's communication difficulties. So, for example, we may have someone with Alzheimer's, and they could have more difficulty with their attention and less cognitive flexibility, whereas someone with Lewy body dementia may hallucinate or have sleep disturbances. Currently, there are over 490,000 Australians living with dementia, and this number is expected to more than double in the next 20 years. Each and every one of these people will or have experienced changes to their communication. Some of these communication changes include difficulty remembering a word and sometimes using the wrong word, struggling to follow general conversation, repeating words, phrases, or questions in conversation, difficulty sequencing words into a sentence with sound sentence structure, fluctuating concentration, talking less than usual. They may have difficulty understanding complex sentences in conversation. They can have increased frustration and fatigue during communication. There are changes in reading and writing skills, and often they can go back to the first language they have learned. So, for example, if they learn English as a second language, they may slowly lose the ability to speak it. So, how do these communication changes affect their quality of life? We can all agree that communication is a really vital part of our lives. It significantly contributes to our quality of life and our ability to convey our thoughts, our wants, and our needs. Someone with dementia experiencing changes to their communication may have less meaningful social interactions, frustrations, and communication breakdowns. They could experience social isolation because of this. They can have an inability to express themselves and to understand other people. They can have less autonomy during daily activities and reduced ability to access healthcare services because of all of the above. People living with dementia require individualized, person-centered care to assist with these communication changes. A speech pathologist's role includes screening and assessing for their communication needs, designing, delivering, and evaluating evidence-based interventions that target really meaningful and functional goals that will ultimately improve their quality of life and their well-being. And we deliver interventions tailored to care for the partners and a person's support network that will support that person living with dementia in their everyday activities and environment. Speech pathologists can provide many communication interventions depending on the needs of the individual. Some of these can include communication partner training, creating external memory aids, environmental support and modifications, and script training. There are many more interventions a speech pathologist could provide, depending on where that communication breakdown is occurring and what that individual with dementia really needs. We consider their strengths and their weaknesses. So I'll delve into just 4 of them as a few examples in today's presentation, but please bear in mind that a speech pathologist can assess what interventions are appropriate for that particular individual. So we'll start with communication partner training, also known as CPT. Communication challenges are reported as one of the most frequent challenges in dementia. It's often linked to higher scores in stress and depression. So training communication partners, which may include their family members, support workers, aged care staff, can reduce stress and improves the quality of life for both that person with dementia and the care partners. CPT involves training communication partners to use different strategies that support that person with the communication impairment during conversation. CPT programs are often individualized and they use education strategies, role play, recording and watching conversations back, and practicing strategies during conversation. Some common skills trained in these programs are verbal skills, non-verbal skills, attitudes and approaches, behavioral management, and using other tools to assist communication. The next intervention is using external memory aids. So speech pathologists can support memory and orientation within the environment through really simple environmental changes. This could be using calendars to identify upcoming events or activities and to promote their participation and their social engagement in them. Using a digital clock with the day of the week, this can help orientate them to the date and the time in an easy to read format. Using pictures or photographs to show location, seasons, experiences, and other orientating information that may get lost in conversation. Daily written schedules to support their orientation and memory. And memory books. This can really help to reduce anxiety and increase the potential for social interactions. These external aids are tailored to each individual and aim to promote their independence in the person living with dementia. Next, we have environmental supports and modifications. So people living with dementia may become more confused or agitated when they're overstimulated, such as by clutter, alarms, TV, or other background noises in their environment. Speech pathologists work to reduce these environmental triggers to support the person to focus better on the conversation-related activity. So it could involve the use of familiar objects, outdoor areas, use of bright light and colour, and signage. Signage can be used to orientate to spaces, objects, or even be used to convey their schedules or give reminders on activities. This signage should be really colourful, have contrasting font and texture, and just contain a digestible amount of information that can be understood by the individual, so it's not too overwhelming. It should also be set at a height and location for the individual to see and use both text and pictures to convey the message. Speech pathologists can assist to identify the appropriate signage for the individual by considering their communication strengths and their abilities. The last intervention we are talking about is script training. So script training is a useful intervention to support communication within specific daily activities in various social settings. Scripts should be relevant to the person's goals and their daily life and their practice within these situations. Scripts could include taking a phone call or even ordering a coffee. It involves repeated practice of the same script to improve that person's confidence to complete these tasks on their own. So, what are some strategies we could use to communicate with someone with dementia? We'll start by focusing on the strategies for early to mid stages of dementia. So each person with dementia will have differing strengths and weaknesses in their communication. So it is really important that we do cater these when adjusting the way you communicate with them. So use the tips that you believe will work best for you both. The way someone with dementia communicates will vary on a day-to-day basis, and it will change as the disease progresses. So it's important that you adjust the way that you are communicating according to these changes. Speech pathologists can assess the individual's strengths and weaknesses and provide individualized communication strategies as the disease progresses. So something we can do is reduce distractions in the communication environment. For example, eliminating all background noise by turning off the TV or moving to a quieter room. This makes it much easier for someone with dementia to focus on the conversation and what you are saying to them. If the person living with dementia is having trouble thinking of the right word, ask them to explain it or describe it instead. Avoid filling in the gaps and speaking on their behalf. Speak about a topic that's familiar to them. So if the person with dementia is having trouble thinking of the right word, ask them to explain it. Oops, sorry, I've just had a technical difficulty. There we go. Speak about a topic that's familiar to them. So you can use memories from their childhood. Often when we have dementia, we go back to the past and all the memories from our past are in the forefront of our minds. So speaking about things from childhood are a really easy topic to try and connect and bond with the person with dementia. You can also use photographs or videos to assist with their memory while speaking about a specific topic. You can use short, simple sentences and avoid asking too many open-ended questions. So opt for questions with a yes or no response or a question with a choice of two items. So for example, would you like to watch TV or go for a walk? Or would you like to watch TV instead of what would you like to do? What would you like to do can be very open-ended and can be difficult for the person with dementia to find what they'd like to do. You can use pictures and or hand gestures to help with your speech, to help them to understand what you're saying and follow conversation. If the person with dementia doesn't understand what you're saying, you can try rephrasing it or simplifying it further. Okay, so we'll shift our focus to the late stages strategies of dementia. As that person with dementia progresses, you may find it more difficult to communicate with them. Even if all speech has been lost, verbal and non-verbal interactions can give that person increased quality of life. It can be a really positive and rewarding experience for both parties. So some communication strategies to connect to someone in the late stages of dementia might be, if the person responds well to physical touch, can hold their hand, keep their attention, show affection, which can be really reassuring to them. You could consider playing music and singing along to it, particularly music that the person is really familiar with. Consider going through old photos with this person, can improve their well-being and give some comfort to them. Think about the emotions behind any words or sounds that are made rather than the content of the words or sounds. As I mentioned earlier, wrong words can be used and they can be incorrectly replaced. So try and read their emotions rather than the type of word that they're saying. You can make eye contact with the individual, smile, and have open and relaxed body language. This gives them a lot of reassurance and connection. And lastly, if you're unsure of how to communicate with the individual, simply being present with the individual can really improve their well-being. So speech pathologists can enable people living with dementia to maintain roles, relationships, and meaningful participation in their lives. Referrals to speech pathologists in dementia are more than just dysphagia. If you have a loved one with dementia and you are looking for some individualized strategies for improving their communication, please reach out to our speech pathology team and we would be more than happy to assist you. Thank you everyone for joining. The recording will be available shortly and we will email you the link to rewatch as soon as it's live on our website. Thank you.